Hi, my name is Ronald Hidalgo. I'm a medical doctor here in Springfield, Illinois, working for clinical radiologists. I've been asked to talk to you a little bit about the new RS85 Prestige platform by Samsung.
And I'm Danette Romero, Business Development Manager with Samsung. I'm also a registered diagnostic medical sonographer with over 27 years experience. Really excited to show you what the RS85 Prestige has to offer. It's based on crystal architecture, which is an incredible new imaging processing technique that allows us to penetrate deep into the body, offer multiple color technologies as well as advanced technologies like contrast imaging, shear wave elastography, and excellent MSK imaging.
So, I've got a great patient here today who we're going to show you some of these advanced features on today, so let's get right to it. One of the first things I want to talk to you about is just the ease of use of the machine and some of the features that help you have a clearer picture. And one of those things would be starting by the quality of this high resolution monitor that we have here. The monitor itself can show you multiple pictures simultaneously, as I have some great examples here on the screen. We can make it widescreen for you to have a bigger picture. And immediately below it, we have a touchscreen monitor. That touchscreen monitor allows you to switch between your probes, access your patient information, switch between all your different settings, between color, microvascular flow, elastography, any of those features that you may need to see on the machine. And below that is a simple to use button panel. On there we have the same thing, power Doppler, color Doppler, switching to 2D, doing your annotations, all of those things, and available both a touchscreen keyboard as well as a physical keyboard on the other side of the surface. So aside from that, those are the things that you probably can see for yourself, but I want to talk to you a little bit about how this machine works and how we use it for advanced imaging and some of the features that we have. So first thing I want to show you is just some of the high quality grayscale imaging of the liver that we can obtain using the machine. So I'm going to have her bring out one of our probes and just show you some liver shots.
I'm going to start by using the CA1-7 transducer. This is a single crystal transducer. What I love about this transducer is it gives me excellent image uniformity from near field to far field without a lot of changing of the parameters. It has a wide field of view, and also I have an option to increase that field of view if I have somebody with hepatomegaly or a need for a wider field of view.
You can see the high quality of the liver. You can see the clarity of the internal vasculature. Here you're getting shots of the gallbladder, and you can see how black the inside of the lumen is, which help us detect any kind of pathology that would be inside. If we need to, we can go ahead and turn on color mode. So here we are, we're seeing the vessels that we want to see, and we're not getting that artifact that we don't want to see. And again, with just a simple touch of the button, she can show me pulse Doppler right on the portal vein. And you have both the ability to see it like this, where you see the live Doppler, and with one more push of a button, I can have both simultaneous imaging in color and Doppler, and with a high frame rate so that you're not losing either part of image quality. So now I can see exactly where she's imaging. So if the patient breathes, she can adjust just like she did right there. It's a perfect example. One of the other neat features that we have is something new called LumiFlow. It adds a three-dimensional overlay to the color that you were seeing, trying to help you get some increased sensitivity to the surrounding color and give you just a little more detail to the movement of the blood within there. And here you can just see some great pictures of that three-dimensional model overlying the color map. So once we turn that off, I'm going to show you one of my favorite modes. This is called microvascular flow. In microvascular flow, we're trying to detect some of the smaller vessels that are a little bit harder to see. Now, of course, you're going to see some of your bigger vessels as well. And with one touch of a button, she'll switch to the renal protocol. I love seeing this in kidney because it really shows some of these vessels well. So here, using MV Flow, you're able to see those nice vessels centrally within the kidney. But now you're able to see the detail of all these small vessels going out in the periphery of the cortex. Those are the ones that we want to be measuring when we're doing our renal artery Doppler. So here we're able to see that he has great flow all the way to the periphery of his cortex, showing great healthy kidney here. And even in the background, you can see how it's picking up some of the flow within the liver, some of those smaller vessels, and then some of the bigger portal vessels and hepatic vessels coming in there. One of the other features that I can show you is, while we got a picture of the kidney and the liver here, is we have a great feature. It's called EasyHRI. And so what we'll see is she's going to find us this great sagittal picture of the liver and the kidney in the same plane. She's going to zoom it in for us, get us nice and focused in that area. And with a simple touch of the button, she's going to freeze the screen. She's going to push the EasyHRI button on the screen, and it's going to find 2 points of interest in both the liver and the kidney, Might be a little hard to see there, but the machine picked those instantly. So the machine segments out the kidney, segments out the liver, and finds exactly where to put these regions of interest. With one more push of the button, the image is saved. Now, of course, if you don't totally agree with how this has put those ROIs, you have the ability to go in and change that. So using the scroll wheel, she can move both, either the liver or the kidney, just by simply moving it. And you can see as she moves it, it's dynamically changing these numbers. These numbers are a measure of the brightness within that ROI, and it tells you the ROI of the liver and the ROI of the kidney, and then gives you a ratio of the two. That ratio is one of the things that we use to try to monitor patients and see if they have fatty liver disease. She's able to save that, and we're able to move on to the next part of the study. Next, I want to show you some of the higher level liver imaging that we have. So she's going to give me a great intercostal window, and I'm going to show you 2D shear wave elastography. And once she gets perpendicular to the plane of the liver, with a push of the button, she's going to turn on shear wave imaging. We're going to put that ROI 1 centimeter or more below the liver capsule. We're going to have the patient hold his breath, not take a deep breath, just hold your breath for me for a second. She's going to move that ROI just by simply moving the scroll wheel. Once we get there, what we can do is we can turn on dual live so we can see both the shear wave picture as well as the 2D, the grayscale representation. If we need to know what we're looking at, we can also turn on the RMI, which is reliability index. All right, go ahead and breathe for a second. All right, hold your breath one more time for me. And as you can see, it populates. She can freeze the image. Once she's frozen the image, it's just a matter of turning on elasticity measurement button, and you can see it created an ROI. If she wants to change the size, it's just one more push of a button. Picks the optimal size, then she begins to right-click into the space that she wants these ROIs to be in. After you get 4 to 5 measurements, you'll start to see that you'll get a KPA and both an IQR. And as you all know, based on shear wave elastography, we want to get that IQR below 30%. If after we've done all of our measurements, we're finding that we're not below 30%, we simply try again. Now, one of the great features of the RS85 Prestige is you can actually hit a profile button. We can take some manual out if we want to, so she can just simply unclick it, say I didn't like that measurement. We're able to save it like that, and it dynamically adjusts the values. Now, if you think you need to do a little bit more to that, she can reload that profile. She could take another image, reload the profile. And if you want to let the machine do it, it can automatically try to profile this for you from a push of a button. It'll get rid of any bad measurements it may have seen. Now, in this case, it felt like she did a great job, so there was nothing to do. So now she's able to save the image, and now we've got a great 2D shear wave elastography of this patient's liver. So I want to show you some of the fat quantification tools that we have available on the RS85 Prestige. So we're going to go back to 2D, and then we're going to turn on the QUS module. Perfect. All right, in a second, I want you to do the same thing. Hold your breath. Perfect. And now all she has to do is turn on either the attenuation or the scatter index, just like that. So she'll adjust the ROI, get it into that perfect position. And what it'll do is it'll give you a measure of attenuation and scatter, with attenuation being how the ultrasound beam speed is being affected by the liver, by the fat quantity of the liver. And then by simply clicking the TSI button, she'll measure the scatter. So she'll measure the way the fat is affecting the scatter of the sound beam itself. We can use this to track patients who are getting different medications, or we're monitoring for NASH, trying to figure out what's going on with their liver and how their treatments are progressing. So curved imaging and intra-abdominal imaging isn't the only place that we see the RS85 Prestige excelling. One of the other things we have is a new high-resolution 2:14 linear probe. This is great for imaging small parts. It's great for doing MSK imaging, breast imaging, any of those things. So I'm going to show it to you just on this patient's thyroid today. She just picks up the probe, hits the quick preset button, and we're instantly ready to go. And of course, the gel is warm because it's sitting in our nice gel warmer. So here we can see high-resolution pictures of the thyroid. Crisp, clear, lots of detail. And again, this probe does a lot of the things that we were able to see with the curved probe. We're able to turn on color. And we can see those vessels coursing through the thyroid, and you can see this carotid pulsating in the background there. And again, if we want to see things using LumaFlow, we're able to turn on LumaFlow. See that three-dimensional overlay on top of the picture. From there, we can go into MV-Flow, see some of those smaller vessels within the thyroid gland. Now, MV-Flow has two different modes. We have a color mode and a power mode. This is what you see in color mode. This is my favorite, is the power mode without alpha blending. There we go. And here you can see there's got this purple background and a red map. Now that's not what you have to do. Everybody's gonna have their personal preference on it. So simply by turning a knob, she's gonna be able to change the color map, and she'll go to my favorite, which is color map number 2. I think this provides a great contrast between the color itself and the background, kind of fading it out. Now some people want to be able to see both, so again here you're able to do dual live imaging. And now we can see both that MV flow map and the gray map of the thyroid itself. This comes in real handy if you're doing thyroid biopsies or you're evaluating a thyroid nodule and want to see if there's any internal vasculature, perhaps trying to find an ideal place to image a thyroid gland or approach a nodule to biopsy. The other thing we can do is we can turn on shear wave, just like we did in the liver. We can evaluate 2D shear wave elastography of thyroid nodules, trying to see if there's any correlation between the stiffness of the thyroid nodule and the likelihood of malignancy. So again, you can see it's going to generate that map over his thyroid gland. We can go into dual live so we can see both it and the RMI map simultaneously. So there you can see it's with the color. We'll turn on the reliability map, and we can get an idea of how good these images are. Now, one of the other great things we can do with this linear probe is called needle mate. Fortunately, he doesn't have any biopsies that we need to do today, but if we were doing it, we can actually beam steer and try to get you a better visualization of the needle. Thyroid isn't the only place that I've had success with the 2 to 14. I've also been using it in the legs, trying to get better evaluation of calf veins. So in a second here, we're gonna get all prepped. We're gonna move down to his legs, and I'm gonna show you some of that imaging of the calf veins. So here, she's already started showing you the calf veins, and you can already see the high detail of the muscle all in the leg. But here you can already see the vessels in his leg. His leg vessels are very, very well demarcated. You can see they're nicely dark in the lumen, so if there's any kind of thrombus, we would see it very well. She's compressing, and you can see the compressibility of his calf veins. Now, some protocols may involve color. So she's going to show you some color imaging there, and you can see, again, great color images, showing you flow within the calf vein, showing you the compressibility, and showing you that lack of artifact, even from the motion of her putting that compression on there. Now, I like to do my calf veins in long, so she's going to go ahead and switch for me. Elongate out those calf veins, and we're going to see that we're picking up flow, even in these calf veins. You can see both the arterial flow, and you can see the flow in the calf veins. Now, of course, if we augmented, this would only be even more visible. Now, one of the areas that I particularly like is MV flow in the calf veins. And the reason why I like it is calf veins can be hard to see. They can be small, or they can have some thrombus in it, and you can't really tell if you're just getting poor color or thrombus. So turning on MV flow, we're able to see the flow in those vessels without having to do the augmentation. It's so sensitive to flow that we're able to see it pretty much in any scenario. Now, one of the things that I tell my sonographers to do is to make sure that you get me 3 vessels. And the reason why I require 3 vessels is you can see there's no directionality that comes with this particular image. So, by showing me 3 vessels, I know that I've seen 2 veins and an artery. Now, let's say you want to confirm that you're looking for 2 veins and an artery. We can actually turn on that pulse wave, and we can confirm that we're looking at either arterial flow or venous flow. So we know that his calf veins are patent, and this works great in larger patients or in patients that you just can't augment for whatever reason. Even those very edematous calf veins, we've been seeing that we're able to pick up flow with MV flow that we weren't able to pick up before using color Doppler. And again, you may have a big leg where you might not be able to penetrate well enough. We can also evaluate the calf veins using the curved if we have to. Now, one of the other areas that we see this linear probe excelling in is MSK applications. So I want to go ahead and just show you an application showing you the Achilles tendon. So I'm going to go ahead and switch over my probe into an MSK setting here. I'm going to get you a picture of his Achilles. So here we can see great picture of his Achilles tendon. You can see all the striations of that tendon. As we move up into the tendon, we're going to move into his musculotendinous junction. There you can still see the tendon. We're getting to the musculotendinous junction. As we move into the meat of the tendon, we can see how great that tendon looks. Lots of great striations, no areas of edema, no abnormality, and I can follow that all the way down to its attachment, down at his calcaneus. Same thing. Now, if I want to, I can also do 2D shear wave on there. Turn on shear wave imaging. Do dual live so I can see both the shear wave and the live image at the same time. Get it right over his Achilles. And now I'm able to tell if there's anything that looks like edema or any abnormality in the shear wave that would tell me that he may have some underlying pathology in his Achilles tendon. So again, just like I've shown you before, we're able to measure that and get you a measure of that stiffness. Well, thank you for watching our presentation today. I hope that I gave you a great overview of everything that the RS85 Prestige has to offer. And if you have any more interest in finding out more, please feel free to reach out to your local Samsung rep or any of our representatives here on the virtual RSNA setting, and we look forward to talking to you. Thank you.